Sure.
All right, we're on the record at 1:03 p.m. on March 4th, 2022. This will be the remote videotape deposition of Jeffrey Michaelson, MD. The court reporter is Bonnie Smith. Will counsel please introduce themselves and state any objection to the witness being sworn in remotely?
James Potts, no objection.
Paul Reynolds, no objection.
Heather McGrady, no objection.
All right, Dr. Michaelson, would you raise your right hand? Do you swear the testimony you're about to give in this cause be the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
Dr. Michaelson, state and spell your full name, please.
Jeffrey Michaelson, Jeffrey-Michaelson.
Do you have a middle name?
Evan, E-V-A-N.
Did you have any communication, emails, texts, calls, conversations, meetings with anyone regarding this case or your deposition other than your lawyers?
No.
Do you have any recollection of Billy Saunier other than what's in the medical record?
I do not.
Did you review any documents in preparation for your deposition here today?
I did not.
You're a physician
Correct.
and you specialize in pulmonology
Correct.
and you're board certified in pulmonology.
I am.
And pulmonology is what?
The study of diseases of the lungs and how to take care of patients with those diseases.
And that's what you were called in as a consult for Billy Saunier in November of 2018?
From what I can recall from looking at the record, it was more of a chronic cough
Uh-huh.
that had been evaluated in the office, and family wanted us to follow up on that.
You also diagnosed Billy Saunier with shortness of breath. True?
No, not true.
All right. I'm going to show you what's been previously marked as Exhibit 1 to your deposition. I'm going to show you what's been previously marked as Exhibit 1, which is a certified copy of the medical record for Billy Saunier for November of 2018. This is page 118. Do you see that in the lower right corner?
I do.
And do you see where it reads consult by Jeffrey E. Michaelson, MD?
I do.
And you are Jeffrey E. Michaelson, MD?
I am.
And you consulted for patient Billy Saunier on November 23rd, 2018
Correct.
at 5:21 in the evening.
Correct.
And this is your note, WellStar Pulmonary Medicine consultation note?
Note that I co-signed.
All right. And you're employed by WellStar Pulmonary Medicine?
I am.
And it reads here, reason for consult, SP, and what does SP stand for?
As post.
CABG, and what does CABG stand for?
Coronary artery bypass.
And do you see that next phrase, quote, short of breath on 4 liters, family wants pulmonary 2C.
Do.
And that's the reason you were consulted on the 23rd?
Presumably.
What do you mean presumably? Is the record inaccurate, false?
Well, that, as you see, is in quotes. And so that was taken from what was listed as a reason to see the patient by the primary service, cardiovascular surgery service.
Mm-hmm.
However,
I couldn't understand that last part. What was it?
that was by the cardiovascular surgery service and what they listed as reason for us to see the patient.
Uh-huh. And you disagree with that? Go ahead.
He hadn't quite finished, James.
All right.
Yes. However, when questioned the patients, it turned out that it was more in regards to the family wanting us to follow up on a chronic cough he had that was unremitting after being seen at the office by my colleague.
Mm-hmm. Were you finished?
That's correct.
It reads pulmonary assessment. This is your assessment.
Correct.
These are your notes.
These are the notes I co-signed.
And it reads, you co-signed the notes, you read them before you co-signed them,
Correct.
and you co-signed them because they were accurate.
Correct.
Reads pulmonary assessment, acute respiratory insufficiency. Do you see that?
I do.
And acute means what?
Sudden.
And respiratory insufficiency means what?
Difficulty breathing.
All right. So, well, acute also means serious.
No,
Object to form, you can answer.
no, not necessarily.
Well, not necessarily, but it can.
That's not how I perceive it.
All right. So acute. Go ahead.
Let's go ahead and finish.
I perceive it as acute versus chronic. So acute is sudden and chronic is long-standing.
All right. And it reads, let's see. You've got cough, chronic. This is the continuation of the note that you co-signed.
Correct.
It's been having cough worked up as OP prior to admit, and OP means what?
Outpatient.
By Dr. Dowdle. Do you know Dr. Dowdle?
Do.
And it reads unclear etiology. Is that right?
Right.
And etiology means what?
Cause.
And so it was unclear to you the cause of the cough.
I'm sorry, I missed that. Say again.
It was unclear to you what was causing the cough?
Yes, at that point.
And pulmonary plan, this is your plan?
Correct.
And it reads, if you can see, 2/3 of the way down, maintain adequate pain control to help patient with cough effort, reinforce need for splinting technique to cough.
I can.
And what is that?
What is splinting technique?
Oh,
What
the
he's
splinting
asking you.
technique. Is that what you, okay. So that is a way to cough without eliciting pain from his surgery.
Mhm. And you see this DVT prophylaxis heparin sub-Q?
Do.
And DVT prophylaxis, that means what?
Medication to prevent clots from forming in the legs.
Well, DVT stands for deep vein thrombosis, right?
Correct.
And prophylaxis is what, a preventative measure?
Correct.
And heparin, have you ever prescribed heparin?
Sure.
Have you ever discontinued it?
Yes.
Have you ever administered it?
Well, I've ordered it, but I haven't administered directly by hands, no.
And have you, when you discontinued heparin, have you ordered a non-heparin anticoagulant like argatroban?
It's possible in my career, but I can't give you a time or a date. I can't recall.
All right. So when you cared for Billy Saunier, did you observe any shortness of breath?
No.
All right. And is it possible that a patient, when you saw him, is not exhibiting shortness of breath and was exhibiting shortness of breath before you saw him?
Sure, I guess that's possible.
Well, the reason for notes is so that healthcare providers that come before you or after you know what you observed when you were with the patient, right?
Correct.
Because healthcare providers that were there before you otherwise wouldn't know that.
Correct.
Same thing about a healthcare provider that came after you.
Right.
And the note that you read said that your patient, Billy Saunier, was suffering from shortness of breath before you cared for him.
By whose notation?
Well, the notate, let me pull it back up.
Yes.
Make sure we get it. We're looking at Exhibit 1. Do you see in the lower right corner, page 119, page 118?
Yes.
And immediately above where it reads Pulmonary Medicine, which is your medical group, right?
Right.
That's your name. It reads Consult by Jeffrey E. Michaelson, MD, at 11/23/2018, 5:21 p.m. That's you.
Correct.
And this is your note that follows for the next couple pages.
Right.
And it reads, the primary pulmonologist, Dr. Dowdle, result for consult, SP, Cabbage, short of breath on 4 liters, family wants pulmonary to see. Is that right?
Correct.
And that's your note, the note that you signed.
Correct, but that's not my notation. As I mentioned before, that's from the consulting service. It's in quotes. That's what was the reason that cardiovascular asked us to see. That was their writing, their notation.
Right. So cardiovascular, unless a note is false, observed Billy Saunier suffering from shortness of breath on November 23rd, 2018.
You guys have form, you can answer.
Right, that was their assessment.
Right.
But
And
not
that's,
mine.
I understand. And that's why you were called for the consult, right?
Again, presumably.
Well, that's what you've written here, right?
Correct.
All right. And would you have written that there if that wasn't your belief?
Well, that's all we had to go on at the time.
Right.
That's why it's in quotes.
Any reason to believe that the cardiothoracic group or cardiology group was notating that they observed something that they did not observe?
Could you repeat the question?
You wrote in your note, quote, SP Cabbage, short of breath on 4 liters, family wants pulmonary to see, close quote.
Okay,
Yes, that's what you wrote.
right, I agree. That's what's on the chart, correct?
That's on the chart because that's what you were told by the cardiology group.
Correct.
That's what they placed in the medical record for Billy Saunier in November of 2018.
Correct.
And medical records, you agree it's important that medical records are accurate.
Correct.
And the reason it's important that they're accurate is so that healthcare providers coming after you know what you did,
Right.
know what you observed.
Right, and that's why I'm saying what I observed was different from what was listed as the reason for consultation.
Objection moved to strike is non-responsive. You agree that it's also there so that a physician or another healthcare provider coming after you would know what you observed.
Correct, that's why I documented what I observed.
And there's no reason for you to believe that that note was false or inaccurate.
No,
You agree that shortness of breath is a sign or symptom of heparin-induced thrombocytopenia?
Jet to form, you can answer.
no,
Your testimony of shortness of breath is not a sign or symptom of heparin-induced thrombocytopenia?
correct.
Cite for me any text, medical textbook, nursing textbook, chapter in a textbook, treatise, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything in the history of medicine that you're aware of that reads that shortness of breath is neither a sign nor symptom of heparin-induced thrombocytopenia.
I'm not aware.
You're not aware of any literature?
Correct.
Where did you come by the information that shortness of breath is neither a sign nor symptom of heparin-induced thrombocytopenia?
Clinical experience.
Anything else?
No,
Have you ever had a patient die of heparin-induced thrombocytopenia other than Billy Saunier?
Jet to form, assumes facts, not in evidence, you can answer.
not that I recall.
Have you ever cared for a patient that was suffering from heparin-induced thrombocytopenia?
I believe I have.
How many patients?
I can't recall.
More than one?
Sure, probably more than one, less than 10.
All right. So this clinical experience, quote unquote, that you just mentioned for the proposition that shortness of breath is neither sign nor symptom of heparin-induced thrombocytopenia is more than one and less than 10.
As well as any other information I may have obtained through other means that I can't recall.
Objection moved to strike. Were you
He's
finished?
trying to, James, he's trying to answer your question, and I don't think you intended to, but you cut him off. So let him finish, please.
Go ahead, doctor.
Yes, those experiences with those cases, as well as any other information that I have come across in my years, through which I can't recall, but yes, that all adds up to my clinical experience.
Your clinical experience with heparin-induced thrombocytopenia is somewhere between 1 and 10.
In terms of patients,
Yes.
correct.
Well, have you cared for someone that was suffering from heparin-induced thrombocytopenia that was not your patient? And if so, explain how that happened.
Alert
No,
from
I
mail. The message statutory electronic service, notification of service for case 19F00.
Not sure what that was.
That's my computer.
Would you like me to repeat the question?
No, thank you, though. I'm going to show you what's been previously marked as Exhibit 2 to your deposition. This is a laboratory report for Saunier Billy Lee, collected November 25th, 2018. You seen this laboratory report before?
I can't recall.
We go down to page 2 of the second page of the report. Do you see the highlighted portion?
I do.
It reads heparin-induced thrombocytopenia, AB. You see that?
I do.
And the AB stands for antibodies.
Correct.
Immediately beneath that, it reads HIT antibody. HIT standing for heparin-induced thrombocytopenia.
See that?
And to the right of that, it reads, there's an asterisk, and it reads present heparin-induced thrombocytopenia, antibody present. You see that?
I do.
Immediately beneath that, it reads patient expired.
Right.
And that's because, sadly, Billy Saunier died there in November 2018 at WellStar's Keystone Hospital. Right.
Okay.
And when you cared for him, you were aware that he was being administered heparin?
Sub-Q, yes, on my note.
Yes, sir. And it reads, call to Barbara RN at 2310-11/26/2018. That's when the report got back to the hospital, the information from the report.
It appears that way.
And of course, Billy Saunier had already died by then, right? Is that your understanding?
It is my understanding.
And it reads optical density. You see the H there? The H stands for what?
High?
And it reads 3.501. Right?
Yeah.
And you see that normal range to the right, the parenthetical?
I do.
And that reads 0.000 to 0.399. True. So Billy Saunier's heparin-induced thrombocytopenia antibodies, when his blood was drawn on November 25th, 2018, at around 11:20 that morning, was nearly 10 times the high normal range.
Okay.
You agree with that, right?
That's what it appears.
Well, this is a lab report that was part of the certified medical record that was provided to us by WellStar Keystone Hospital. Any reason to believe that it's false or inaccurate?
No.
I'm going to show you what's been previously marked as Exhibit 3 to your deposition. when you cared for Billy Saunier, and what days did you care for him? Do you recall?
I believe the initial consult was the evening of the 23rd. I saw him the next day, the 24th.
Yes, sir. And is it your recollection you cared for him on November 23rd, 2018 and November 24th, 2018, and that's it?
Correct.
And you had access to his patient records there at the hospital?
I did.
As a physician, when you care for a patient, you have access to that patient's medical records?
Sure.
And that's important because you want to have all the information that you need to make a proper assessment and diagnosis.
I do.
You've heard of what's called a SOAP note?
I have.
A subjective, objective assessment, and like you wrote in your note, plan. Is that right?
Correct.
And then so I'm going to show you. It's been previously marked as Exhibit 3 to your deposition, which is a heparin timeline from the record. Were you aware when you cared for Billy Saunier that he'd been receiving heparin both by drip and by bolus, as well as subcutaneous for 8 and 9 days when you cared for him?
James, just for purposes of clarity for the record, you indicated that this was a heparin timeline from the record, and this is not part, the timeline itself is not part of the WellStar Keystone Hospital medical record. It's a timeline that your office created from the medical record. I just want to make sure that that's clear.
Yeah, that's why I said precisely that. I said prepared from the medical record. Doctor, we can take some time and go through the medical record, but we have pulled the heparin that was administered from a certified copy of the medical record that we were provided. And my question to you is the same. Were you aware that Billy Saunier had been receiving heparin since November 15th, 2018, when you cared for him on the 23rd and 24th?
Object to the form, state facts not in evidence, as there were days he didn't receive heparin, but subject to that, he can answer.
Joint.
No, I was not aware.
All right. And that's because that's not your area. You would leave that for cardiology and the cardiothoracic group?
Correct. That was not of my purview.
Yes, sir. And because you weren't administering heparin, right?
Correct.
You didn't discontinue the heparin,
I did not.
nor did you have any conversations with any other healthcare providers about administering heparin, discontinuing heparin, or whether to start a non-heparin anticoagulant.
I did not.
Did you look at Billy Saunier's platelet count when you cared for him?
I imagine so. I probably glanced through the labs.
Right. But the reason you would have glanced at those is because that too was outside your purview as his pulmonologist.
Correct. It was more to what I was being asked to evaluate when discussion ensued with the patient.
Got it. You are aware that heparin-induced thrombocytopenia is a serious side effect of heparin,
I am.
and it can cause death.
Yeah.
I believe you testified earlier that, to your knowledge, no patient of yours other than Billy Saunier has ever died as a result of heparin he was being administered.
I'm going to object to the form, but you can answer.
I don't think I testified to that. mentioned was that I've taken care of patients with hits.
Yes, sir.
As
You,
to whether or not they-
I'm sorry, go ahead.
as to whether or not they survived or died, I can't recall.
The only one that you recall is Billy Saunier.
Object to the forms, assume facts not in evidence. You can answer.
John,
Well, by review of the record, it appears that way. I didn't know at the time.
I understand. Are you aware of something called the 4 T's, a scoring method used in diagnosing heparin-induced thrombocytopenia?
I'm not.
And I don't recall your answer. Did you have ordered argatroban or another non-heparin anticoagulant? I believe you testified you did. Do you recall doing that? Or not?
I may have in the past while treating these patients,
Yes, sir.
but I can't recall when or at what time or what date.
And as you sit here, though, you don't remember one way or another whether you've ever ordered argatroban or not?
Correct.
Are you aware that if you discontinue heparin, that you have to supplant that with a non-heparin anticoagulant like argatroban?
check.
Object to the form.
You may answer.
I believe that's correct.
And not to do that would be below the standard of care?
Check.
Object. Join in the objection.
Well, I can't comment on standard of care. That's not, again, my purview. I would leave that up to the hematologist.
All right. That's all I have. You be safe, Dr. Michaelson, and enjoy the rest of this beautiful day.
All right, thank you.
Sir, bye-bye. Bonnie, I'm gonna leave this on for you to get those exhibits.
Going off the record at 1:37 PM.
Bonnie,